hundreds of workers will be staying at home during the 21-day nationwide lockdown, which started at midnight. But essential services workers, like the nurses, the doctors and others, will be working today. Our reporter Masego Rahlaga is in Vosloorus, where she's accompanying the one nurse who is being taken to work today by public transport. Masego, good morning to you. So you're joining us from Katlehong. Tell us who you are going to be accompanying and what the process you're going to follow will be.
Good morning, Xoli. I am accompanying a male nurse from Telemogorane Hospital. His name is Rich Siqina. He's one of the workers that have been deemed an essential service. Of course, Xoli, as you can imagine, nurses themselves are also afraid because, of course, as they meet some of these patients who are coming into the hospital, whether negative or positive, at the end, they do say that they are afraid to contract the virus. And of course, Xoli, you can imagine the lives of their family members that they come back home to. They're worried about that, and a lot of them that I spoke to earlier this week were pleading with South Africans to please adhere to the rules set by the government to stay at home. So now I'm going to start walking, and I just want you to meet Rich. Here is Rich. He will be going to work this morning. As you can see him in his uniform. He actually was even saying a silent prayer today, as, the person, one of the people in the front line for what's, for this lockdown.
Yeah.
I'm just going to ask to speak to him, Xoli, as we walk, of course, to the taxi rank. Rich, today is the day. We start the lockdown today. You're going to work. You have to look after the sickly, some of them not even coming to test for the virus. How are you feeling?
The word essential has never been so powerful and meaningful than ever. Like, I'm proud of myself. The country is facing a pandemic, a disaster that has a potential of wiping almost million of South African citizens. And as nurses, we are trusted with our expertise, our knowledge, to be on the front line of defense. So I'm saying, let me go there, bring it on. Let me go there and protect our people. Yes.
Rich, when you think of the rules that the government has set for South Africans to, for instance, stay at home, to make sure that, they take precautions like I have, as you can see, what's your message to South Africans in the next 21 days? Because I mean, this is it for South Africa.
I often say in life, it's a principle. If you want to get what you want, if you want your desires to come to pass, you have to usually do what you don't want to do. And behind every achievement, there's a price to pay. Unfortunately, at this moment, the price to pay is that we are not going to make profits. We are going to stay at home. We are not going to get that particular income. But nonetheless, we need to comply. It's unfortunate. It's a price that we need to pay if we want to beat this pandemic and if we want to beat this merciless coronavirus. People must stay at home, adhere to those rules, wash your hands religiously so, wash those hands, and don't go to our healthcare facilities unnecessarily. Even if there's someone who's sick, don't accompany those people, don't accompany your relative, like at least reduce the accompanies, the escorts, at least to one. If there is a need for you to go to our healthcare facilities, it's either clinic or hospital, don't go to shops unnecessarily. So let's stay there. It's only 21 days. After 21 days, we'll come out of this victorious. I am just pleading to our community, because if you don't comply, you are putting us into deep end of death as healthcare professionals, allied workers, cleaners, and all those essential services. We are just pleading to our community and citizens.
Lastly, Rich, you're using a taxi. You're going to be catching 2 taxis to work today. The taxi, you have to sit so close to each other. And, with this pandemic, we've been told to keep our distance. How are you feeling about the taxi? Are you hoping they comply, the taxi drivers?
I hope taxi drivers are going to comply. My problem is that they are limited. As a result, we might be many outside there who need these taxis. Then you are asking yourself, are they going to comply, or they are going to look at that opportunity to say, can I take 6 people instead of taking 12? Because that is what taxi drivers are going to say. But I hope they are going to comply. Yes.
Thank you so much. Well, Xoli, as you can see, we've been walking for quite a bit. The streets are silent, and our drive here from the office to Katlehong, the streets have been very silent. We haven't seen any law enforcement officials on the street, but it looks like South Africans are really adhering to the rules, and they are not on the streets this morning. Yeah,
Masego, we'll be tracking you as you make your way to the local hospital there in Vosloorus with Rich Siqina. That's the male nurse that Masego is talking to there, and you've seen her taking him from home onto the streets, and they're going to go and hopefully board a taxi to one of the local hospitals. I've got to point out that the mask that Masego is wearing, I would have also been much happier to see Rich Siqina, the male nurse, also wearing that mask, because there is talk that there is a shortage of these masks.